Major roadblock for the vaccine rollout in the U.S. boils down to hesitancy over taking the shots. A CBS News poll last month showed 22% of respondents said they will not get the vaccine, threatening the country's chances of reaching herd immunity. That is why lawmakers and public health officials are turning to focus groups, like the one led by Republican pollster Frank Luntz, meant to understand why some vaccine skeptics held out on getting the shot, but then later had a change of heart. Dan Diamond is a health reporter for The Washington Post, and he joins us now with more about this. Dan, so great to see you. Thanks for coming on. This was a politically diverse group, from conservatives to liberals. Why do they say they were initially hesitant to get the shot, and then what caused them to change their mind?
Well, Vlad, there were a few reasons that they were hesitant. One is, and this comes up over and over again, there are questions about the speed of the vaccine, how quickly it was developed, what we know about the long-term effects. And I think those are legitimate questions. The record for a vaccine before this year, the mumps vaccine, it took about 4 years to develop. The coronavirus vaccine, under a year. So that's something that comes up over and over again in these focus groups and polls. I think another reason that many people in the focus group, particularly Republicans, had questions, they believe that coronavirus itself has been politicized, that it was used against President Trump in a bid to get him out of office, or that Democrats have made too much of a show of it. So that's another issue that runs through these focus groups.
A separate focus group with younger voters told Luntz that they didn't feel it was necessary to get the shot because they are rather at a lower risk of getting really sick from COVID. And then some young black adults in that same group said that they were less worried about the virus and more worried about the risk of police brutality. I think it's really interesting. I mean, we did tell younger people over and over again that they were less likely to get really sick. And now I suppose it's not surprising that younger people would think, well, then I don't really need to rush to get this vaccine. In regards to, younger black people and the concerns about police brutality, I mean, you've been watching the news. This is part of a national conversation. Once again, it's not surprising that they would say, this is not my top priority right now. But what concerns you about hearing this, and what is missing from the messaging that's coming out from our public health officials?
Well, Anne-Marie, that's such a good point. I mean, it stopped me short to hear in that interview, in that focus group, with the younger adults who were saying things like they were more worried about police brutality than COVID. I mean, the science doesn't back that up. At this point, COVID is killing and afflicting young Americans in relatively high numbers, given that they're not as vaccinated as older Americans. But I think what has both changed minds and what public health officials are trying to do is they're trying to provide good information about why the vaccines are safe, why they're effective. For instance, at the vaccine speed wasn't due to cutting corners, but it was cutting red tape and scientists being honest about what we know, that if you get infected with coronavirus, there could be some consequences, versus what we don't know yet, which is 5 years, 10 years down the road. We don't have that kind of data on what it means to be vaccinated. But the balance of evidence is that there are benefits to getting shots. And what public health experts are trying to do is put doctors, put credible messengers in front of skeptical audiences. And whether that's someone like Tom Frieden, the former director of the Centers for Disease Control, who got on some of these focus groups, or if it's people in the community, pastors, local educators, community leaders in other ways, who have credibility with people who might be wary. The Federal Health Department has deployed what's known as the Community Corps, which is almost a door-to-door operation. I've seen it here in Washington, D.C. Volunteers going to people's homes and saying, here's some information on the vaccine, here's where you can go to get vaccinated, and here's how to make a plan to make sure you and your loved ones are safe.
You talked about trust, Dan. Have you seen, I mean, it's remarkable to me, for example, in a country like Israel, where we look at what they've been able to accomplish in combating this epidemic. And there are a lot of other countries like this, Singapore, South Korea. You don't see the same level of skepticism around this pandemic, around the vaccine, around whether or not the number of deaths are inflated or underreported. What do you make of it, just based on your years of covering health as an industry? in the fact that there are places all around the world who are doing a much better job of one of the richest and most powerful countries in the world? Is it simply because this pandemic became so politicized in this country?
Vlad, that is such an interesting question. I don't know how much time we have, but the idea that in the U.S. we responded out of the gate in a very different way than in some countries in East Asia, which had experience with pandemics in ways that we had not. So I think there was more infrastructure ready to be activated. You mentioned Israel, which has moved very quickly to not just vaccinate its population, but use vaccine passports. In my mind, I think some of that just dates to their ethic of service. Virtually all adults end up serving in the military there because of that country's rules. So there's almost a obligation that people in that country have that I think in America, we're much more disparate. We think differently about what our responsibilities are and what our relationship to government is. And I will say, you talk about getting out of the gate in a bad way and where the U.S. might be versus other countries. We were just talking about that this morning in our team meeting at the Post, how in some ways the bad start in 2 or 5 years, in 10 years, the U.S. might look very different just because of how many people we have vaccinated. Yes, hesitancy is a huge issue, but if you're looking at the total numbers, there have been 150 million Americans given shots, 250 million shots given out altogether. We're really lapping a lot of the world when it comes to distributing vaccines. So as the pandemic evolves and changes, the U.S. may end up being in a pretty good place compared to other countries around the globe.
You know, I heard this morning, I think somebody was talking about getting the message, and you sort of brought this up, getting the message out through people that individuals trust, the doubters trust, and they included their primary care doctor. And when I heard that, I thought to myself, but how many people see their primary care doctor very frequently if they have one? I mean, I'm one of those people that I really don't have a primary care doctor. If I'm sick, I go to a walk-in clinic, and then if I have something else, you know, I go to a specialist. And I wondered if there's an understanding of how we are using the healthcare system, a modern understanding of how we're using the healthcare system. I know there's statistics that are saying that sort of the number of people who have primary care doctors continues to kind of diminish. And I think that kind of may leave an opening for things like conspiracy theories to undermine the public's trust, because, you know, oftentimes we really don't see the doctor unless we're really sick, and that might be, you know, once in a blue moon.
Yeah, I mean, I see CBSN hosts more than I see my primary care doctor. I can't remember the last time I did. So there absolutely is. I don't know if you have any medical advice for me, but there absolutely is an opening for getting messaging. And unfortunately, for a lot of Americans, it does fall to social media, conservative media. I've been in these focus groups where people have talked about something that they saw on Facebook about coronavirus that was absolutely not true. And just a few days ago, I talked to some researchers at the University of Pennsylvania who looked into this. And folks who relied on conservative media in the early days of the outbreak were much more likely to believe conspiracy theories like the virus was engineered by the Chinese government as a weapon, or that the pharma industry, the drug industry, had intentionally created the virus in order to boost sales. And they also found, and this is a good thing, I think, if you watch broadcast news like CBS, the researchers did find a link with people being more likely to take public health steps, wearing masks, and being willing to go get shots.
Dan, so one of the things that I find really fascinating, you mentioned that the United States now is lapping a lot of other countries when it comes to vaccinating its citizens. But because there are clarion calls by our health officials that we may never achieve herd immunity because of the hesitancy that some people have expressed, I wonder that eventually the rest of the world will catch up. That is the intention of every world leader, even if they are going through some difficult times now, for example, like in India. I wonder in a year or two, there's two questions here. One, will the United States, when I was a foreign correspondent based in Nigeria, at the time Nigeria was only one of 3 countries in the world that still had polio outbreaks, right? It was Nigeria, Afghanistan, and Pakistan. And I wonder if the United States, as the rest of the world catches up and achieves herd immunity, that we will be one of those countries where if you're a citizen of another country, you think to yourself, well, good thing I'm vaccinated if I'm, a Danish citizen or if I'm a French citizen or Singaporean, because I got to go to the United States and coronavirus is still rampant there. That's my first question. And then the second one that I have, I guess, is over time, are we prepared for the next pandemic? Because that was something that President Obama faced under his administration with Ebola, which obviously wasn't as big of a calamity for us as it was in other parts of the world. And you saw early on in the former President Trump's administration a dismantling of some of those efforts to go after pandemics once they rear their ugly heads. Are we prepared for the next pandemic? Because every health professional says we're going to get one. So I guess those are the two. There's sort of a two-pronged question there.
Those are great questions. So I think I was with you, Vlad, on that first question. Is the U.S. going to be this hotbed of coronavirus as the rest of the world moves on? And I don't think that's the case anymore. I did think that in early 2020 when we were having such a bad go of it. And yes, cases are still relatively high here. But I was looking at data last night around the world, and there are countries like Sweden and Turkey and France where their coronavirus case numbers are much higher than they are in the U.S. And our numbers have dropped as vaccinations have rolled out. I don't think we're all that far away from getting to a place where the numbers really drop off. If we have about half of all people here vaccinated now, we're probably going to have about 70% vaccinated in the next number of weeks. There's evidence that case numbers will really fall. Now, if there's a variant of the virus that could spread, that could challenge people who have been vaccinated, and the real fear is that we have a big population of people who don't get shots, and then the virus kind of circulates in them and mutates in ways that can challenge everybody. So we're not out of the woods, but we are looking better as a nation. Now, to the second idea about being prepared for the next pandemic, also a great question. Last year, when I was at Politico, I wrote a story in April 2020 about, I think the headline was like, inside the 2-decade failure to prepare for the coronavirus pandemic. And the lesson to me isn't that we weren't prepared for coronavirus, it's that we're never prepared. Every administration forgets the lessons of the last administration. The Trump administration got rid of things that Obama left. Obama got rid of things Bush left. Bush got rid of things Clinton left, and so on. So every time that we get away from a crisis, we forget the lessons of that crisis. I don't think that's going to happen with coronavirus because this is a crisis that has affected so much about the world, we won't be able to forget it so easily.
Dan Diamond of the Washington Post. Always great to have you, Dan. Love your reporting. Thank you so much.
It's a real pleasure to be here. Thank you.